With robotic minimally invasive surgery, it's been a fantastic technology brought here to the Med Center. Many patients that come to us are used to a traditional approach where the chest is opened up through the midline, the ribs are spread completely apart, and although that has been a traditional cardiac surgery approach and technique, it's always astounding to see patients' reactions when we tell them they don't need that same approach. Because Dr. Liao has specialized in robotic minimally invasive surgery. We're able to make a small incision through the fourth and fifth intercostal space, about that big, sometimes smaller, sometimes bigger, depending on the patient's body size, and do the whole surgery through that incision. Educating patients before surgery, I know that they're anxious, and I know that we can help them, and I wish the time from meeting them to the time that they're going to the OR was the instant, because I know how well they're going to do after. Patients generally come in first day of surgery, go into the OR, they can have a couple of tube supports, things like that are generally removed much quicker than a traditional sternotomy approach. They're out of bed, sitting in a chair, breathing on their own, taking 1 to 2 short walks by day 1, and 90% of the time patients are leaving the hospital day 3 to 5. So to be an expert cardiac surgeon in the mitral valve in the US, you do 5 mitral valves a year. We tend to do 5 a week. We have used the robot on many, many complex cases that would not be able to tolerate a traditional cracking the chest open, and we still have maintained one of the lowest mortality rates in the nation while completing over 10% of the total nation's cardiac surgeries. So that's pretty amazing.